morning, doctors. Welcome to another podcast on cghsclinics. We have a very different topic today. For that, we have with us a well-known person, backbone of IT services of cghs Pune. But he is here today as an experienced homeopathy physician, Dr.Kamesh Rao. Welcome, Dr. Kamesh.
Thanks, Dr. Nagesh, for the kind words, and thanks for the opportunity of this podcast. And before I begin, I would like to congratulate you personally on the success of clinics of CGHS, which is now sort of going viral across CGHS cities, I should say. And I'm sure it will be a big hit in the coming days. I wish for its continued success.
Dr. Kamesh, I'm a little curious about the way homeopathy physicians approach their case. Is it the same like ours, allopathy people, like history, examination, test, and some diagnosis, and then proceed? Or do you follow some different approach?
That's a good question to begin with. Well, the approach of a homeopathic physician to a patient is very similar to that of any allopathic physician. That is in terms of history taking, examination, investigations, and then coming to a diagnosis. However, the similarities end here because a homeopathic physician has to do a lot more further before prescribing the right medicine, and that is of diagnosing an individual. In fact, diagnosis of the individual, or what we call individualization, is very central to homeopathic approach to any given case. Let me explain here what I mean about the diagnosis of an individual or individualization. According to the homeopathic principles of treatment, among many individuals suffering from the same disease, every individual is different from the other, different in reaction, different in feelings, and different in expression or manifestation of symptoms. To explain it a bit further, supposing there is a case of fever. As an allopath, you would simply prescribe either an acetaminophen or a non-steroidal anti-inflammatory or antipyretic. But in the same case, for us homeopaths, to arrive at a right medicine, we need to look deep into the case and elicit other symptoms of the fever. Say, for instance, thirst. It's natural to expect the patient to be thirsty during fever, but when we inquire further about the character of the thirst, we may find that while in some patients the thirst is characterized by taking small quantities of water very frequently, while other patients may take large quantities at a single instance. While in some others, they may not have thirst at all, even when the fever is very high grade, which is again a very unusual symptom. So the selection of medicine depends on these factors. Let me give another example to exemplify it further. Supposing the patient comes to you with a cough, you simply prescribe an antitussive or an expectorant. But we homeopaths are helpless with just cough as a symptom. We need to know what time of the day or night this cough comes on, in what position the cough is aggravated or relieved, or how does intake of water, either cold or warm, modifies the cough, what is the cough sounding like, so on and so forth. I mean, we need to know the modifying symptoms of this cough. So unless these symptoms are gathered and analyzed, a homeopath would not be in a position to prescribe the right medicine for the patient. So we homeopaths need to collect these sort of attributes of a given individual patient and prescribe a medicine that matches these attributes. These attributes can be at a mental, emotional, or a physical level, or the combination of all. So thus we need to look at what is called a symptom totality and then look up for a medicine that matches this totality. Therefore we say, even though many people suffer from the same disease, they may need different treatment plans. And nowadays, I guess even allopathic approach is changing slowly. Now you're recognizing that one size fits all approach is not working, and you're talking of tailor-made treatment plans. I'm not saying it's exactly homeopathic, but your outlook is different now from what it was few years ago. Anyways, so a mere diagnosis of a disease is not enough for a homeopath, but we need to differentiate one patient from the other who are all suffering from the same disease. But it does not mean that we do not bother about the nosological classification at all, because if we don't, it would be a big folly. Because we individualize the patient's symptoms and segregate from disease symptoms, by disease symptoms I mean the symptoms suffered by all patients diagnosed with that disease. If we do that, we'd be in a big soup if we do not know to bother about the disease symptoms or the diagnosis. We may then confuse the disease symptoms with the individual patient symptoms and arrive at a wrong medicine. Therefore, a homeopath must be very thorough with the knowledge of the disease or the diagnostic component, the knowledge of the individual, and the knowledge of the medicines for designing a good treatment plan for a patient. The diagnosis is also important so that one can define the scope or applicability of homeopathy in a given case.
Dr. Kamesh, can you give us a list of conditions or symptoms where the other streams of medicines struggle a lot in giving results to the patient, where homeopathy has a definite advantage, and where we can refer to you as a first choice therapy?
Rather than approaching this question through an inclusive method, let me address this through a method of exclusion. By exclusion, I mean the cases that do not fall in the domain of homeopathy. Homeopathy is not applicable in cases where the cause of the disease continues to be present, and it also cannot be applied in cases that spontaneously resolve once these causes are removed. For instance, cases that belong to this category are some vitamin deficiencies, which have to be corrected only through supplementation. It cannot be applied in cases of road accidents with head injuries, loss of consciousness, fractures, severe bleeding, and critical emergency conditions such as acute MI or conditions that require basic or advanced life support systems. Then there are conditions where there are advanced pathological changes, end-stage diseases, which cannot be cured by homeopathy, although we can provide some complementary or palliative pattern of treatment. A similar complementary approach can be adopted in genetic or metabolic diseases where the prognosis is variable. And homeopathy is poorly effective in case of immune suppression, especially in patients who are on drugs like steroids, cyclosporins, or methotrexates, etc. It's difficult to give a laundry list of conditions that you can refer to homeopathy as a first choice. But I strongly feel the so-called functional cases, if you would, of chronic recurring nature where you don't find a cause and therefore unable to address the problem satisfactorily, they definitely fall in this class. It is here, in these cases, patients express a lot of symptoms that are seemingly inconsequential to you from a prescription standpoint, but we homeopaths tend to attach a lot of importance. And we love them because those are like bread and butter for selection of a suitable remedy. We have seen very satisfactory results in several pediatric cases where you can avoid routine antibiotic prescriptions. Then there are some surgical cases of hemorrhoids or fissures where we have seen excellent response and where we can predictably and confidently declare the outcome. Several cases of allergies, respiratory, GI, dermatological, and speaking of dermatological, we have seen some very good results with variety of skin conditions from allergies to eczemas to fungal dermatitis, and several orthopedic cases including various forms of arthritis, some benign forms of growths. Warts, every allopathic physician knows to refer to homeopathy, and some prostatic hyperplasia, etc. Finally, one thing I would like to mention, in any given case, for whatever reasons, either the patient cannot explain or express the individual symptoms clearly, or the physician cannot elicit the characteristic symptoms that are required for a prescription. In either of these cases, a favorable outcome through homeopathy treatment would be limited.
Dr. Kamesh, you would agree that two conditions, irritable bowel syndrome and vertigo, are very difficult to treat. What options do you have in homeopathy?
Okay, let me take up IBS first. It's a well recognized fact that IBS patients typically have associated mental health problems. Majority of them having a generalized anxiety disorder or depression symptoms, the reasons for which may widely vary. Be it in any type of IBS, whether it's a constipation type or a diarrhea type, a mixed type or a post-infectious variety, in my experience, I've seen several happy patients of IBS while they are on homeopathic treatment. Generally, we adopt a two-pronged approach while treating a chronic recurring functional IBS type cases in homeopathy. During acute phase of the disease, we address the constipation symptoms or diarrhea or the pain symptoms, and there are specific class of drugs that address these acute symptoms. And when the acute phase subsides, we move on to introducing more deeper acting medicines that tend to address the condition on the basis of underlying personality of the individual IBS case. In our history taking, we observe that most often the onset of IBS is linked to a significant life-changing or traumatizing event in the life of the patient. Instances of this include either death of a family member to whom the patient is closely attached, loss of a job or a dominating boss at a new job with whom the patient is unable to cope up with, failed love affairs, etc. Even in some children complaining of some recurrent non-specific abdominal pain or frequent diarrheas, we found domineering parents, children who are not allowed to express, anxious children who have school or exam phobias, etc. If not addressed very early, they tend to suffer from prolonged symptoms which affect the quality of life in adulthood. So, in homeopathic literature, we find different medicines to tackle the impact of such life-changing events. You may feel that I'm not suggesting any specific medicines for IBS condition. That's because if you go back to what I said on individualization, every case is different and may need a different medicine after analyzing the patient. Having said that, in my personal experience, I did observe that an Indian herb called Holarina antidysentrica helped in majority of the cases, especially in tackling acute diarrhea type IBS cases. Now coming to the vertigo symptom, again I observed very good results, especially in geriatric cases. Once again, we need to qualify this symptom further by eliciting situations and circumstances that aggravate or ameliorate the vertigo symptom. You may be surprised to note that there are close to 450 to 500 such situations or circumstances listed in homeopathic literature. Which aggravate or ameliorate or which modify the symptom of the vertigo. So, for example, we have patients reporting vertigo while smoking, while shaving, while looking up or looking down, while opening or closing eyes, while getting up from bed, etc. I believe this is one such condition or symptom where allopaths can safely refer to homeopathy as first line of treatment, especially those idiopathic cases.
Dr. Kamesh, what you would like to tell us, our audience, about complementing two systems of medicines? For example, in post-chikungunya rheumatoid disorder.
Indeed, we saw some very good response in several cases of post-viral arthralgias, may not be necessarily chikungunya, where again the choice of a homeopathic medicine depended on the individual patient symptoms and the characteristics that they exhibited. But to really quantify these outcomes, we need indeed a collaborative approach. I'm fully for it. With well-defined protocols, we can observe response of such cases by stratifying to the stratifying these cases to either allopathic treatment alone, homeopathy alone, and then a combination of allopathic and homeopathic treatment, and see which of the strategies work in favor of the patients. In fact, I would go on to say that we can even include an Ayurvedic plan in such studies by contacting our Ayurvedic colleagues.
Another question, Dr. Kamesh, is about research in homeopathy. Your thoughts on that?
Thanks for asking this, Dr. Nagesh, because research is very close to my heart. Having worked for 10 years in homeopathic research very early in my career, it gives me this confidence to speak about it. Well, to answer your question, it's not about apprehension, it's a question of attitude and aptitude for research. In fact, I can recall we did our first double-blind trial in HIV in 1996, which was well accepted and publicized. And in India, Central Council for Research conducts research on various subjects across its 50-odd centers, the results of which are published periodically. There is also collaborative research in association with ICMR and independent research undertaken by physicists at BARC, TIFR, and IIT Mumbai, etc. The problem in homeopathic research is we cannot equate or design the protocols in the same pattern as in allopathic drug research for the very reason of individualization that I spoke of in the beginning. The other problem, the garden not to say so, is although the effects of homeopathy can be clinically evident and the physiological changes that homeopathic remedies create in the body have been measured, the exact mechanism of homeopathy or how homeopathy interacts with the body's systems remain unknown. For which reason, time and again we see adverse reports on homeopathic treatment and homeopathic medicines. Anyway, coming back to the research and the protocols, if the protocols are well drawn out in line with the fundamental principles of homeopathy without any deviation, I am certain there will be no problems with quality outcomes. That's what I want to say about the research in homeopathy. And once again, thank you for this opportunity of the podcast. Thanks. Take care. Bye-bye.